This is the Healthcare Marketplace Specialization, Healthcare Marketplace Overview. I'm Steve Parenti, and this is Module 1.1.2, Healthcare Spending Drivers. So let's begin by looking at the distribution of U.S. health spending. What this graph is showing from 2012 is the percent of total expenditures and then the percent of the population. So what we see is, say, the top 1% of the population in terms of spending constitutes 22% of total expenditures. Top 5% constituting 49%, which is actually one of the more striking statistics, that 5% of the population basically is equal to 49% of all our healthcare expenditure dollars. And what it really does focus on is that when we think about where our healthcare dollars are going, really the sickest, if you will, are getting hopefully the amount of money that they need. And then when we get further out in the distribution, it's really a fairly marginal contribution in terms of where their costs are. So here's another way of looking at trend going back in time, 1977, 87, 96. And same issue that we saw earlier, the top 1% basically holding constant at 30% of the spending, 28% of the spending, 27%. If we look at top 5% where we were before, again, pretty much the same thing. A little over half of the dollars are associated with the top 5% of the population, and not much really changing in the lower distributions over a period of time. Where does that money go? This is a really nice diagram showing the lion's share of it. So if we look, say, at hospital care, that's pretty much the largest piece of it. 31% of dollars falling there. After that, the next biggest chunk is on physician services. From there, prescription drugs. People always think prescription drugs have been a huge cost driver. They are expensive, but they're 10% of the overall healthcare pie. We have other personal care that can potentially be some of the diet and exercise types of programs that go in there as well. Nursing homes actually don't constitute too much cost. People think that's very expensive. It is per person, but it's not that big a share of the pie. So when we think about really the biggest chunks, probably add up, 31, 20, and 10. We're pretty much looking at about 62% of the dollars really going for the majority in terms of hospital, physician, and pharmaceuticals. Other things to look at for trends is how much things have been going up or down. That's what we're seeing here, percent change differences over a period of time. And there's lots of variation. There's lots of times when that total graph in black, we see that we're really outpacing inflation several moments here in the 1970s, the 1980s. That's somewhat prescription drugs. There was an increase here in really baby boomers getting procedures on the PPO market. Costs actually were down considerably lower in the 90s. That was largely due to the onset of managed care, really keeping costs down low. And now we're actually seeing a fairly low period here as well, but that's a recession effect. And more recently, if we take this trend out, we're starting to see things trend back up. So the Healthcare Cost Institute's group actually did a lot of work with on their governing chair, and great database of over 50 million covered lives of information from insurance companies under the age of 65 as well as over the age of 65. And so if we see what's really been driving some costs right after the recession period, what we see is that outpatient vision costs are really driving a tremendous amount in terms of hospital. Inpatients, a fairly big driver. Interesting, prescription drugs was not. Now it's a little bit more when you get past into 2014, 15. But keep in mind that this is where healthcare costs is going. This is general inflation, 1.6%. So pretty much over every major category is outpacing general inflation in healthcare. This gets a little more detailed as we look at where things go over a period of time. Here we can see basically all services and what percent change and where things would fall. We also have an estimate here of GDP. Now, granted, GDP in the 90s was actually very strong in terms of where changes might fall. What we do see is that in the 90s, prescription drugs really did increase tremendously. Physicians increased modestly. Outpatient hospital also increased tremendously, and inpatient hospital actually took a pretty big dive. So that did reverse itself a bit when we actually get into the early 2000s. Outpatient hospital also made some amends as well. And prescription drugs is starting to erode. It does pick back up later in the 2000s. Another way to look at this is basically a very simple proposition: expenditures equals price times quantity. We're going to talk a little bit more about this as the class progresses. If we look at percent change in terms of prices versus quantity, what we see is that the price changes actually are a lot of what's driving in the early 1990s, and quantity is going down. That could be an efficiency issue, but they're making it up. And so in net, we actually do see a decrease. Here we flip when we get to the later 90s, where now prices are about where they were before, but now utilization is trending up. And in this instance, now we're seeing utilization trending up even more in the early 2000s, prices also going up, and so as a result, a pretty substantial increase in hospital spending of services. How do we compare to other countries? Familiar theme, people sort of talked about in the popular press. Generally, we have been taking off. Actually, in 1980, we were not that far off from much of the other industrialized countries when we compare purchasing price parity, which sort of looks at different market baskets of goods. We've been pretty much accelerating. We accelerated even more so in the early 2000s, a lot of that with hospital and some additional physician services. We actually got closer to Europe and the rest of the world in the 90s, but didn't continue on that trend for very long. If we look at our percent of GDP, again, we weren't that far off from, say, Germany going into the 80s and the 90s, and then there was actually a break. With Germany, in the case, that was Eastern Europe being integrated back in with the end of the Cold War. The U.S., again, is flat, actually, in the 90s with managed care, and then we have an upsurge, again, going into the 2000s. So where does the money go? Lots of dollars here. This is a pretty complicated chart. It's fine to just pause and take a look at any particular point, but just call out a few things. We're looking at trends over a period of time. It is sobering to see, and these dollars are not inflation adjusted, going from $75 billion in 1970 to $1.8 trillion in 2004 for expenditures, which breaks it down by what do we see in terms of professional services, whether it's physicians or otherwise, home health, actual retail outlet sales of where things are, what administration costs. People always get very concerned about health insurance costs going up, and that's true. In terms of private, if you look at the net cost of private health insurance, it actually might be a little more interesting. The government public health activities are actually increasing fairly well at the same time. Investment in R&D is pretty healthy, actually, overall. But when we look at our costs, per person, we're definitely escalating over a period of time. So, again, the same period of time. Where are these funds essentially going? We actually have private funds in terms of where the dollars are coming in here, and then the public funds in terms of the outlays. And we can really see how Medicare escalates quite a bit. But honestly, so do the private health insurance plans, going from $15 billion to $685 billion by 2004. And you can see that the growth here well exceeds inflation, general inflation running maybe not in the 70s so much, but certainly in the 90s when it's only about 2, 3, 4%. We're well in excess of that throughout the 2000s. A little bit of a small chart, but again, good to pause and take a look at it just to see where dollars are being spent. This is actually extrapolating out now beyond the 2000s. We go from 2005 here through 2020 and the expectation of where dollars are going to be. Right now, the thought is that we're about $2 trillion. The expectation is that by 2020, we will be at about $4.6 trillion in expenditures. If we look at our growth rates, the expectation is that they'll decrease a little bit, and some of this is actually borne out with the recession, but then they'll start picking up back again coming in later. And this does take into consideration the impact from the Affordable Care Act that was passed in 2010. So if we look at where the dollars are going, Medicare is going to double, actually more than triple from 2005 to 2020. Medicaid will go substantially, mostly because of a Medicaid expansion that we'll talk about in the insurance module. When we look at private health insurance, that's employer-sponsored in particular, where most people get their coverage. That'll roughly double from $680 billion to $1.2 billion over a period of time. Growth rates, again, not keeping ties with inflation, but enrollment, interestingly enough, is fairly modest, but our expenditures are outpacing essentially our folks coming in terms of expenditures per person. This concludes this module on healthcare cost trends for the first module of the course.